How do CORT scans reveal early TB missed by X-rays? Imagine trying to spot tiny clues in a busy scene. Chest X-rays give us a flat, two-dimensional picture of the lungs, which can sometimes hide small or subtle signs of tuberculosis. These signs might be tiny nodules, early cavities, or faint infiltrates that are hard to see because overlapping structures can obscure them. That's where computed tomography scans come in. They take multiple X-ray images from different angles and compile them into detailed three-dimensional images. This process allows doctors to see inside the lungs with much higher resolution and clarity. Because CORT scans produce cross-sectional slices of the lung tissue, they can detect very small abnormalities that might be invisible on standard X-rays. For example, tiny cavities in the lung tissue, which are often early signs of active tuberculosis, are more easily identified on a CORT scan. These small cavities can be missed on X-ray because they are too small or because their shadows blend with other lung structures. CORT scans can also reveal early signs like bronchial wall thickening, small nodules, or faint infiltrates that suggest active infection. Another key advantage of CORT imaging is its ability to detect patterns of disease spread within the lungs. The tree and bud pattern, which indicates endobronchial spread of tuberculosis, appears as tiny branching nodules that resemble budding trees. These are often missed or unclear on X-rays but are visible on CORT scans. Additionally, CORT scans can identify areas of healed or latent tuberculosis, such as scars, which are difficult to distinguish on X-ray. They can also show bilateral or multifocal disease, meaning multiple areas affected across both lungs, which might be underestimated on a standard chest radiograph. Because of their sensitivity, CORT scans are especially useful when a patient's chest X-ray appears normal but clinical suspicion for tuberculosis remains high. They can help catch early or subtle signs of infection, leading to earlier diagnosis and treatment. This is crucial because early detection can reduce the risk of transmission and improve patient outcomes. However, it's important to remember that CORT scans are not usually the first step in tuberculosis screening. They are more costly, involve higher radiation exposure, and requiring more resources. Typically, they are used when chest X-rays are inconclusive, particularly in immunocompromised individuals, or when more detailed imaging is needed to guide further tests like bronchoscopy or biopsy. In summary, CORT scans reveal early tuberculosis that X-rays might miss by providing detailed, three-dimensional images of the lungs. They can detect tiny cavities, early signs of active infection, and patterns of spread that are often hidden in standard X-ray images. This advanced imaging helps doctors diagnose tuberculosis sooner, especially in complex cases, and ultimately supports better patient care. Always consult healthcare professionals for personalized advice and diagnosis, as individual cases can vary widely.